Assalamu alaikum. Our topic for this session will be sampling. Sampling methods. We have two main categories for sampling. Number one, probability random sampling, and number two, non-probability or non-random sampling. We will start with probability random sampling, a sampling method in which each sampling unit has a known probability of being included in the sample. Usually, sampling units have equal probability of being chosen in the sample, while non-probability or non-random sampling, a sampling method in which the probability of being included in the sample is not known and not equal for the sampling units. We can start with probability sampling. It utilizes some form of random selection. In order to have random selection method, you must set up some process or procedure that assures that the different units in your population have equal probabilities of being chosen. Humans have long practiced various forms of random selection, such as picking a name out of a hat. We use computers to generate random numbers as the basis for random selection. In the past, we tried the random sampling by picking name out of a hat, while nowadays there is computer programs. There are computer programs that are capable of performing this random selection. First of all, simple random sampling. It is the simplest form of random sampling and called simple random sampling. When the sample frame is small and sample size is, say, less than 20, we can use a simple manual method, writing the names of a person on same size and color paper, put them in a receptacle, example a hat, and then select the sample members randomly. This is the most primitive method for simple random sampling. But with a large sample frame and sample size, we resort to the use of tables of random numbers, or better use a simple computer program. Nowadays, computer programs make this random selection. Example, in a study of primary healthcare clients' satisfaction, the list of attendance during the last 12 months forms the sample frame. The number of these clients is 1,000, and we want to select 100 clients of them with a sampling fraction equal 10%. Investigators may use a table of random numbers, a computer random number generator, or a mechanical device to select the sample. Number two, systematic random sampling. Systematic random sampling is an easier way to complete the sample presented above. Is to select randomly a number between 1 and 10. For example, remember that 1 in 10 is the sampling fraction. Say it come and 8. Then we select patients whose serial numbers are 8, 18, 28, 38, 108, and so on. This is called systematic random sample, and we have to select randomly one number only. Here, in this example, we select 8, 18, 28, 38, and so on, choosing random start and then selecting every ith unit at regular intervals. The major drawback of this method is when there is a cyclic phenomena occurring in the population and we are unaware of it. Example, in a study of maternal child health attendance, the investigators decided to select all women attending antenatal care every Saturday and Tuesday for 6 months. It happened that in the selected unit, the ultrasound specialist is available only on Saturday and Tuesday. And so every pregnant woman who has a problem is automatically transferred to be seen in these days. The researchers ended up with samples of pregnant women with medical problems and not representing all the attendants of that clinic. Number 3, stratified random sampling. If the population to be sampled includes groups or strata that are different in some aspects related to our study objectives, we may use the stratified random sampling technique. In the example of primary healthcare client satisfaction study, the population of clients include males and females and different age groups from newborns to geriatric cases. A simple random sample or systematic random sample may miss a group, for example, female, completely, or the sample may include a relatively small number of one group than the other. Stratified random sampling involves dividing your population into homogeneous subgroups, then taking simple random sample from each subgroup. It is suitable for heterogeneous population. There are several major reasons why you might prefer stratified sampling over simple random sampling. First, it assures that you will be able to represent not only the overall population, but also the key subgroups of the population, especially minority groups. So the heterogeneous groups will be divided into homogeneous subgroups, then apply the simple random sampling techniques inside these subgroups. Number 4, cluster random sampling. A major problem with the above mentioned methods is the need of a sample frame of all sampling units, which may be difficult and sometimes impossible. Examples include sample frame of primary school children in Greater Cairo, women aged 19 to 45 residing in Menofia Governorate, target age group for childhood vaccination from 0 to 5 years in rural Asyut, and female physicians working in Upper Egypt. In such cases, we choose a sampling unit called a cluster that is different from the study unit and include a group of the study units. For the study of prevalence of anemia among primary school children in Greater Cairo, our study unit in the child aged 6 to 12 years old, and the sampling unit to be used is a primary school, which is a cluster of the study unit. A sample frame of primary school in Greater Cairo is much easier to enlist. When sampling unit is a cluster of the study units, the sample is called cluster sample. Clusters may be houses for the study of women in their reproductive age in Menofia streets for studying the vaccination coverage among under 5-year children, or health facilities, clinics, and hospitals in Upper Egypt. to study the female physicians working in that region. Number 5, multi-stage sampling. In real-life situation, sampling is done at many stages and include more than one of the above-mentioned techniques. In other words, we use multi-stage sampling. Primary school is in Greater Cairo are stratified into 3 strata. Number 1, governmental. Number 2, subsidized and private. Simple random sample or systematic sample technique is used to select appropriate number of schools from each strata. Then all or a subset of grades can be used. From each grade, classes will be selected, which is a second stage cluster. Then all or a sample of students in each class will be examined for anemia. So we divide here the sampling into multi-stages or many stages. Number 1, make simple random sample to select school from each type, either governmental, subsidized, or private. Then from each school, we select grades. And from each grade, we select randomly some classes. And from each class, we take random samples from the students. So it is a multi-steps sampling tool. After that, we could study non-probability sampling. Here, don't involve random selection. Here we have a purposive selection. Non-probability sample may or may not represent the sample population. Estimates and predictions from these types of non-probability sampling procedures can sometimes be close to the population values, but their success to do so can't be guaranteed, which is a major problem while using non-probability sampling. You can't apply the results to the whole population, and it is not accepted by the majority of committees to generalize results to the whole population. Almost all non-probability samples are biased. That's to say, they represent only a subset of the population. The difference between non-probability and probability sampling is that non-probability sampling does not involve random selection, and probability sampling does. In applied social research, there may be circumstances where it is not feasible, practical, or theoretically sensible to do random sampling. Here, we consider a wide range of non-probabilistic alternatives. Number 1, convenience sample, which is the ordinary, the easy sample for the research. In clinical practice, we might use clients who are available to us as our sample, like volunteers, students of the nearby school, diabetics, attending Ain Shams diabetes mellitus clinics, and so on. Clearly, the problem with all these types of samples is that there is no evidence that they are representative of the population we are interested in. Just we use the available samples. Number 2, purposive sampling. In purposive sampling, we sample with a purpose in mind. Usually, there are one or more specific predefined groups we are seeking. Purposive sampling can be very useful for situations where you need to reach a targeted sample quickly. The following are selected subgroups of purposive samples. Number one, quota sampling. In quota sampling, we don't have a sample frame, and the process of selecting individuals according to specified criteria is continued till a predetermined sample size is attained. This method is employed in political and social studies. Example, asked to fill a questionnaire about postgraduate statistical course for 40 female and 60 male medical students. You go and start asking every individual you meet if he is a postgraduate medical student having the statistics course, and if he is, you fill the questionnaire. So you repeat these tasks till you have 40 females and 60 males. This is quota. Number two, snowball sampling. Snowball sampling is especially useful when you are trying to research populations that are inaccessible or hard to find. So you focus to find one, then this one person will enable you to reach others and so on. So the snowball will increase in size. In snowball sampling, you begin by identifying someone who meets the criteria for inclusion in your study. You then ask them to recommend others whom they know who also meet the criteria. This method hardly leads to a representative sample. However, it may be the best method available for certain situations like drug addicts. It is very difficult to reach drug addicts. Just if you know one, this one will tell you about others. So your snowball will increase in size. Homosexuals, it is difficult to identify them, but if you know one, you can increase your sample size. Prostitutes and so on. And expert sampling. It is not a random sampling, but it is a purposive sampling by an expert. At the end, thank you. Hope this session is valuable and hope you all the best. Good luck.